Good morning, ladies and gentlemen. We will begin in 60 seconds from now. May I request you to kindly share the link with your family and friends from across the globe. Our eyes are a universal, valuable asset, irrespective of age, caste, creed, color, etc. And hence, this talk will benefit everyone. So get all your friends and relatives, irrespective of denomination, and let us all benefit from this very educative session. We'll give you a few seconds to invite your friends and family members from across the globe, and we begin thereafter. Good morning, ladies and gentlemen, and welcome to the 7th Virtual Knowledge Worth Having series organized by the Catholic Gymkhana Limited. Ladies and gentlemen, as you are probably aware, our virtual show comes to you live using 2 platforms of communication, Zoom and our very own dedicated Catholic Gymkhana YouTube channel. Supporting the show this morning behind the scene are 2 specialist resources, Aubrey Chatelier and Managing Committee member Ian Pereira, who jointly together will assist us in having a smooth transmission this morning. Technology can be fickle, as you all know. And since there is a high dependency on external factors like internet connectivity, etc., we run the risk of losing internet connectivity at any time. In such an eventuality, please hold on. Do not switch off your TV sets or any other streaming instruments that you may be using. The speaker losing connectivity will be back with you soon. So please hold on in case of any break anywhere during the show. Ladies and gentlemen, let me provide you a glimpse of what you can expect over the next 100 minutes. We will start off with the introduction of the speaker, and that will be followed by a discussion with our speaker. Thereafter, we take question and answers from the viewers, and finally, we end with the vote of thanks. Ladies and gentlemen, this is your last few seconds to invite your family and friends for this very, very useful session. For those of you interested in asking questions, please post your questions on the YouTube chat. These will be collated by a control room and transmitted to me as the host and compere at my own control room, and will finally be answered by Dr. Ryan De Souza at the very end. Ladies and gentlemen, this morning I have the pleasure of requesting our very hands-on president, a president who is involved in the nitty-gritty of every program, a president who's completely involved in every aspect of what happens at the Gymkhana. I'm talking about none other than Mr. Vernon Miranda. Vernon Miranda will now have the privilege of introducing our very eminent and knowledgeable speaker of this morning, Dr. Ryan De Souza. Over to you, Vernon.
Thank you, Sanju, for those kind words. Very kind of you. Dr. Ryan De Souza, members of the Catholic Gymkhana, and guests. A very good morning, dear members and guests. It is indeed a great privilege and pleasure for me to welcome you all this morning for what I am sure will be an enriching morning, well spent with Dr. Ryan De Souza on eye care. Friends, I do miss the personal contact with you at our physical talks hosted at the Catholic Gymkhana. And now that CG is operational from this month, I do look forward to meeting you all at the Gymkhana. Sanju has thrust upon me the pleasant responsibility of introducing a charming personality who has established himself at a very young age as one of Mumbai's leading ophthalmologists. Yes, I am referring to Dr. Ryan D'Souza, a practicing ophthalmologist who runs his own state-of-the-art CEDS Eye Hospital in Bandra. Ryan is also attached as an honorary consultant at the prestigious Leelavati Hospital and Medical Research Center. In his career spanning over 20 years, Ryan has consulted at various hospitals in Mumbai, such as the Holy Family Hospital, Holy Spirit Hospital, and St. Elizabeth's Hospital. Ryan acquired his medical degree from MGM Medical College and his postgraduate degree in ophthalmology from JNMC Belgaum when Ryan was awarded the University Gold Medal in ophthalmology. Ryan has been interested in diabetes and its implications on the retina, having completed a medical retina fellowship from the Aravind Group of Hospitals in Madurai. Ryan has also acquired his DNB in ophthalmology and is a fellow of the International Council of Ophthalmology. Ryan has been involved as an FDA investigator in clinical trials for the Restore multifocal IOL implants and was amongst the first ophthalmologists in India to offer modern generation multifocal and trifocal lens implants to patients. Ryan is actively involved in research and academics relating to the anterior segment of the eye, as he has participated in various studies, delivered lectures, and involved in several academic boards across domestic and international platforms. Ryan is affiliated with numerous prestigious organizations, both in India and abroad. Eye health is often taken for granted as people believe they can see well and therefore have healthy eyes. Many eye problems are asymptomatic in their early stages, with vision loss progressing before a person realizes an impairment of vision. I am sure Ryan will guide us on how regular eye checkups can help detect eye conditions early and prevent avoidable vision loss. The good news is that most blindness and vision loss is preventable or treatable if detected early, and who better than Dr. Ryan D'Souza to enlighten us. In his journey in life, Ryan has had the support of his amazingly capable wife, Sonali, who I have known as a little child, ever helpful, ever kind to all his patients. Friends, it is my pleasure to present to you our honorable speaker, Dr. Ryan D'Souza. Thank you, ladies and gentlemen, and over to you, Dr. Ryan, and our host, Mr. Sanju Fernandez. Thank you.
Thank you, Vernon. You did justice to Dr. Ryan with that flowing praise. At a very young age, Dr. Ryan has achieved much already, and you said it all. Thank you so very much, Vernon. That was our president introducing our speaker for this morning, Mr. Vernon Miranda. Thank you. Ladies and gentlemen, it's time to get going with our speaker of the day, Dr. Ryan D'Souza. Formally, welcome to the show, Dr. Ryan. Before I begin with Dr. Ryan, I must confess, when I first heard of the title of the show, which is I and You, I thought it was meant to be a romantic talk about couples and relationships. Stupid me. I thought it was I and You. I did not realize it was I and You. Never mind, ladies and gentlemen. Welcome once again, Dr. Ryan, and thank you for giving us your very precious time to better understand our eyes. Let me get on to this discussion right away. And probably I'd like to begin with a very generic question. Dr. Ryan, what is the significance of regular eye examinations? And would you also be able to cover how often we should schedule such kind of eye checkups? Is there a kind of a formula which is based on age, or is there some kind of a magic trick or some kind of a matrix that is available which would tell you when one needs to go in for an eye treatment or an eye checkup, please?
Thank you, Sanju. At the onset, I'd like to thank the managing committee of the Catholic Gymkhana and the team behind the Knowledge Worth Having initiative and series of lectures for inviting me to be with you here today. Thank you, Vernon, for that very, very kind introduction. Okay, this is a good question to start a talk show with, Sanju. So let's see first, let's understand how do we define a regular eye examination. So there are two kinds of eye examinations, preventive and definitive. A definitive eye examination is very simple to understand. I have a problem and I go and see my eye doctor. I can't see, I have a red painful eye, I have an itchy, scratchy eye. So you know you have an eye problem and you go and see the doctor. What is more important to understand is the significance of preventive eye examination. In the recent past, medical communities all over the world have given so much emphasis to preventive healthcare. So preventive eye examinations have tremendous significance. Let's enlist a few of them. One is, it goes without saying that having the best possible vision can improve your day-to-day life quality. The second is, doing preventive eye examinations can help to detect silent diseases in the eye like glaucoma, macular degenerations, retinal detachments, and various other conditions which otherwise would have probably come to one's attention at a later stage. When detected earlier, as Vernon earlier mentioned, a lot of vision loss and blindness can definitely be prevented. Let's look at children. Timely detection of refractive errors, that is the presence of a number in children, in young children, can lead to unnecessary suppression of vision and medical conditions like amblyopia or lazy eyes. Another important factor in the elderly, having poor vision has an increased risk and tendency to falls, which can severely impact the quality of lifestyle of the elderly, resulting in increased mortality and morbidity. And to end it all, very often it is said that the eye is the window to your body and to your soul. So very often the eye often tells the doctor and alerts the doctor to certain pre-existing conditions like diabetes and blood pressure, which again, if detected in time, can certainly change the overall quality of life of your lifestyle in the long term. Now, coming to how often or how frequent preventive eye examination should be held, well, I don't think there is a defined matrix or however, as a rule of thumb, what we normally advise people after the age of 40 to schedule a routine eye examination, a preventive eye health check, at least once every 2 or 3 years. In normal children under the age of 10 to 15, doing an examination every 5 years is also good enough as long as there are no symptoms. However, if your doctor were to detect any problems, any conditions, or any symptoms, then of course a more frequent schedule may be prescribed.
Dr. Ryan, this was just the opening question, but I've already learned so much. You know, I never ever imagined that probably doing an eye checkup could also lead you to understand if you could be leading on to diabetes as well. Brilliant. I'm sure there's a lot more to come. Tell me, Dr. Ryan, there are different kinds of terminologies that we hear of these days, and these are very loosely used by people to describe eye care providers. Could you let our viewers know what is the difference between an ophthalmologist, or an optician, and an optometrist? Is there a big difference between the three? What really are the ingredients for each of these three eye care providers?
That is a very, very interesting question, Sanju. As you rightly said, there is a lot of confusion in the minds of most lay people as to what is the difference between an ophthalmologist, an optician, and an optometrist. And I think that's an important question you've asked here, because knowing what kind of care is provided by what kind of doctor will help you determine which doctor you need to see at what point of time. Okay, so to make things very simple, an optometrist is a technician who is trained to assess your eye as far as your vision goes.
Okay.
So your optometrist is qualified, can assess your refraction, and is able to prescribe contact lenses and spectacle glasses to you. In certain countries, optometrists are trained well enough to also assess the general health of a normal human eye. An optician, on the other hand, is the dispenser of these prescriptions. So an optician would be a person who is trained to read, to interpret these prescriptions written by an optometrist, and to dispense glasses or contact lenses. So the optician is the dispenser, while the optometrist is the prescriber.
Okay.
The ophthalmologist, on the other hand, is a doctor, is a medical doctor who has acquired a medical degree and is trained in surgery of the eye. So an ophthalmologist, in addition to being able to assess the health of a normal eye, in addition to being able to assess the refractive status of the eye, can also assess specialty diseases and disorders of the eye, and is able to prescribe medications as well as to perform surgery to correct these problems. Well, there are also lesser known eye care providers like ocularists, vision therapists, orthoptists, low vision specialists, but of course that's a different question altogether. And so just to sum this up, if you have a normal healthy eye and you don't have any specific problems, and you just want to have your number checked, or you want prescriptions for your glasses, a visit to an optometrist is in order. However, if you have specific problems, difficulties with your vision, which cannot be corrected with glasses, then a visit to the ophthalmologist would be more prudent.
Interesting, Dr. Ryan. Doctor, very often we hear of different kinds of eye diseases, right? And today we have the challenge of understanding which are these, what are these eye diseases and what really it can do for each of us. Would you be able to enlighten us on what are the various or the commonly encountered eye disease that any person could really be infected with?
Right, Sanju. So when you talk about eye disease, there is a whole encyclopedia out there. Okay, you'll be surprised at the number of diseases and the types of problems that can affect the human eye. However, let's talk about the more common problems that we see. And we'll try to cover most of these problems as this talk goes on. So most people, when they think of eye problems, will think of cataracts and similar conditions. But you'll be surprised to know that in most OPDs, the most common eye problem that we see are actually refractive errors. That is, difficulties associated with vision that can be corrected by the prescription of spectacle lenses or contact lenses. And right from children to adults, refractive errors remains the most common problem that we see in our OPDs. In the modern world, and especially during the pandemic, a lot of digital eye strain and dry eyes have also been reported. So digital eye strain, dry eyes, and refractors form a significant component of eye conditions and eye diseases today. In addition, other well-known eye conditions include cataracts, glaucoma, retinal diseases like macular degeneration and retinal detachments. And of course, lesser common conditions could include macular holes, squints, lazy eyes, amblyopias, and so much more.
Dr. Ryan, I heard you mentioning glaucoma as one of the diseases. Now, what exactly is it? How is it detected? And more importantly, if you would be able to explain to our viewers, how is this managed in 2021? Is it different from what it was before? What exactly is the story behind this?
Right. So glaucoma is a subject that I can take days to cover. And I think I want to summarize this into something that your viewers can understand well. So can I share? I think I have a small presentation that I would like to share. Let me try and share my screen. If you will give me just a couple of minutes, let me try this.
Go ahead, doctor.
Right. So let me know. I'll just put up this presentation.
Yes.
So are you able to see my screen?
Yes.
Fantastic.
Very clearly,
Okay.
doctor. Go ahead.
Fantastic. So the first thing is glaucoma is not cataract. Glaucoma is a different problem by itself, and we call glaucoma the silent thief of sight. Silent because most of the times there are no pain and there are no symptoms. Now, what is glaucoma? Glaucoma is not one disease. Glaucoma is not a single disease. Most people think of glaucoma as, I have glaucoma, I have one disease. It is actually a spectrum of disease. And most people think that glaucoma is a disease involving eye pressure, and you're not wrong. But glaucoma is not only about eye pressure. Glaucoma is actually a disease that affects the optic nerve of the eye. So our understanding of glaucoma from the time I was a student 30 years ago to today has undergone a sea change. Glaucoma is so let's understand glaucoma is a progressive, see, each word is important here. It's a progressive damage to the optic nerve.
Oh, okay.
And there are many factors. There are many factors that could be responsible for this progressive damage. Right. One of the identifiable and modifiable factors being the eye pressure, the fluid pressure of the eyeball. But there are many other factors, including the blood flow to the eye and various unknown factors that could also affect the course of glaucoma.
Right.
Now, who is at risk? I want each of you here to understand this. If any of you fit into this category, you could be at risk to glaucoma. Glaucoma is most prevalent above the age of 40 in people who have a family history of glaucoma. People who have comorbidities like diabetes, hypertension, high myopia are more prone to glaucoma. Smokers are more prone. Now, the next point is very important. If you have taken steroid medication for anything in the past, it could be something as innocuous as steroid puffs for asthma or steroid creams for the skin, you could be at risk to developing glaucoma. Certain medications can cause glaucoma, injuries to the eye can cause glaucoma. Simple symptoms like frequent headaches, seeing halos of light, or even something as a frequent change in your reading glasses could indicate that you are at probable risk to developing glaucoma. Now I'm going to show you a few pictures so that you understand what glaucoma does and why is glaucoma silent. So let's imagine this is a picture of what normal vision looks like. You can see a monument in the background and two very lovely children standing in the foreground, a beautiful picture. Now, what happens in the early stage of glaucoma, and mind you, these pictures are just representational. You see the periphery of your vision starts getting clouded. Okay. So very often at this stage, I'm still able to see what I'm looking at those two beautiful children and I can see them. And I might miss that something is not right in the periphery of my vision. At this point of time, I have no symptoms. And if unfortunately I do not get detected or diagnosed at this stage, then it's very, very possible that early glaucoma has set in and I am being set up for more advanced problems. Now, this is moderate glaucoma. So the field of vision starts contracting in. Now, by this point of time, significant damage has already been done to the optic nerve. And let's look at what happens in extreme glaucoma. So extreme glaucoma is when you have tunnel-like vision. It's like looking through a straw. And unfortunately, a lot of patients come to us either when they have moderate glaucoma, that is something like this, or extreme glaucoma. And one thing I would like to highlight, one thing here, glaucoma is irreversible and it is untreatable and it is progressive. The earlier you catch glaucoma, the earlier you detect the onset of glaucoma, the more of the chances you will be able to control glaucoma. Glaucoma is not treatable, it's not curable. If you control it when detected early, you probably protect yourself from the extreme damage that glaucoma does to the eye. How do I know I have glaucoma? Very rarely do you have any definitive symptoms. You will be surprised to know that almost all the glaucomas I have diagnosed in the last 20 years of my careers have been patients who have come in for routine eye examinations and not even known they've had a problem. And eye pressure is probably the only recordable and modifiable factor. But there are so many factors beyond the eye pressure. That's what I was talking about, a spectrum of disease. You have people with normal eye pressure and yet progressive damage to the optic nerve resulting in glaucoma. You have people with high pressure but no damage to the optic nerve. So it's a symptom complex. It's a complex entity, and we are starting to understand more and more as time goes by. How do you live when diagnosed with glaucoma? You and your ophthalmologist become best friends for life. You need routine eye examinations, possibly a lifetime of medication, because glaucoma, as I mentioned a while ago, is only, it's controllable, not curable. And of course, once advanced glaucoma happens, we have options like lasers, surgery to try and stop the glaucoma or slow down the progression. Of course, in the future, hopefully we will have newer drugs and implants. So I just want to bust a few glaucoma myths. So if I have normal vision and no symptoms, I do not have glaucoma. Wrong. Glaucoma only affects the elderly. It can affect children as little as months old. Glaucoma will only happen if I have high eye pressure. Another myth. As I mentioned a moment ago, glaucoma can affect you even if you have normal eye pressure, but you have progressive structural damage to the optic nerve resulting in loss of peripheral field of vision. If I don't have any symptoms, I don't need treatment. Again, another myth. If no one in my family has glaucoma, I won't get the disease. Another myth. So these are a few common myths that I would like to bust, and these are the facts that I would like to put forward. Glaucoma causes irreversible and progressive blindness. Please pay attention to this. There are no second chances with glaucoma. It is not curable. There are no symptoms to warn you. You can only prevent further progression, and therefore early diagnosis is important. And that's where we started the talk this morning. One of the reasons why we should have routine eye examinations done. And glaucoma is not caused by stress, watching TV, reading, using your computer, using the phone. There's nothing you can do or cannot do to prevent glaucoma except for routine eye checks and following these rules. I hope I've been able to, in a very short time, give you the gist of what glaucoma is all about.
Dr. Ryan, I really do not know what to say. So beautifully explained, absolutely clear. It's amazing. Some of the information that you've already shared with us is absolutely amazing. Dr. Ryan, during the process of getting ready for this discussion, there was some amount of research that I had tried to do on my own on eye diseases. Can you let our viewers know what exactly is macular degeneration? I heard of this very often, came across it when I was doing the research as well. Now, is this condition treatable? And more importantly, is this the same as retinal detachment as well, or is it different from macular degeneration?
Okay, another good question, Sanju. So we're talking huge diseases today, and each of these diseases, I could go on speaking for hours or days. Okay, so again, let's take the next common problem and let's try and get this into a concise few minutes. Okay, so first, when you talk about macular degeneration, this is unfortunately a problem that's becoming increasingly more common in the last decade or two. When we were students, we rarely ever saw macular degeneration, but in the last 2 decades, the incidence has significantly gone up. We are still trying to understand the reasons why. So to understand this, let's first understand what is the macula. Okay, so to understand this, okay, let's go one step further. What is the retina? So the retina is basically the light sensitive tissue that lines the inside of the eyeball at the back. If you think of your eyeball as a tennis ball, the inside of the eyeball at the back is lined by this highly specialized light sensing nerve tissue, which is nothing but a complex extension of the brain. And this is known as the retina. Now, in the retina, the central region of the retina is super specialized for vision. And this region is known as the macula. Okay, so all complex vision processing, your central vision, your color perception, your contrast perception, all this happens at the macula. In a nutshell, the macula is what is responsible for seeing the object of your attention. So if I'm looking at you right now, your image is falling on my macula. And everything else is falling on the peripheral retina. So you can understand why the macula is so very important. If I lose function of the macula, or there's disease of the macula, whatever I'm looking at will not be seen or will not be seen clear enough. So macular degeneration is a disease that affects the macular region of the retina. Okay. Now, macular degeneration, there is a complex pathophysiology behind the whole thing, and we're still trying to understand it. It's not like we've even understood the whole thing. So just to sum it up, there is a progressive loss of structure and function in the macula. And one of the most common causes for macular degeneration is abnormal aging. I use the word abnormal aging because there are 2 types of aging that takes place, right? One is normal aging. All of us are getting older, right, Sanju? So we gray, we are turning gray, we wrinkle, we bald. These are normal aging processes which happen to everyone. But there are certain abnormal aging processes or accelerated aging processes that don't happen to everyone with age. One of them being macular degeneration. So what happens here is the macula starts losing function, and the complex, intricate cellular architecture of the macula gets disrupted. So you start losing vision in your central field. So if I'm looking at you, what happens is I'll say, what happens, Sanju? I can't see your nose, or I can't see your mouth. I don't know if you're smiling. I can see your face, but I can't see whether you're smiling. So this is central loss of vision. Just going a little further, there are different types of macular degeneration. So you have the wet form and the dry form. The dry form, in fact, it's very slowly progressive and usually doesn't impact vision significantly. And because it's slowly progressive, the impact is much, much lesser. However, you need to understand that there is absolutely no treatment for the dry form. And then you have the wet form. The wet form is the aggressive form of macular degeneration that we need to be aware of. The one that rapidly and aggressively steals your vision. So what happens in the wet form is abnormal blood vessels grow into the macula from beneath the macula, and they form a kind of a complex there that causes loss of vision. So this is macular degeneration in as brief as I can mention it. Aging is one of the causes, but there could be many other causes like injuries to the eye, inflammations in the eye, and various other causes that are there. And yes, to end this, macular degeneration is completely different from a retinal detachment. They're chalk and cheese. So macular degeneration is a disease that involves specifically the central area of the retina, whereas retinal degeneration, detachment can involve any part of the eye, right from the periphery to the center. And it implies basically a separation of the retina from the wall of the eyeball. And the common causes of detachment are typically injuries to the eye, traction in the eye, and various other causes. And one last take-home message for our viewers is, if you have a high minus number, a high myopia, you are at increased risk to developing retinal detachment. And it is always advisable during your visit to your eye doctor to have your retina examined for this risk to detachment of the retina.
Sure. Dr. Ryan, I'd like to go back to where we began, your very first answer. And I remember you talking about, how you could really detect if you're heading for diabetes just through an eye checkup. Let's talk a little bit about this, about diabetes. What is the impact of diabetes on the eyes? All right.
Okay, so
and a corollary question to that. How do we manage the effects of diabetes on the eyes? Is there something that we as patients could do to protect ourselves? A lot of us as we age are bound to sometime or the other get diabetes and have some kind of an impact on ourselves. So some thoughts on this, doctor.
So you've got me into a territory that I love. Diabetes, the impact of diabetes on the eye has been one of my most favorite topics. It was one of my thesis topics. I've done a thesis on diabetic retinopathy, and this is something I could talk for days on end. But let's try and get this clear some. So the first thing I want our viewers to know is a lot of people are surprisingly still not aware that diabetes can damage the eye.
Right.
So diabetes is not only about high blood sugar. When you have diabetes, everybody's obsessed about figures. My sugar is 80, it's 120, it's 140, it's 160, it's more than 200, it's 300. Everybody's obsessed about figures. It's the least important thing. The end organ damage that diabetes does on the eyes, on the kidneys, on the nerves, that is what is important. So let's talk about the eye. So Sanju, I think here I'm going to deliver a visual impact. So I'm going to share another short presentation. So give me a moment. Let me share this presentation with you.
Certainly. Go ahead. Go ahead, doctor.
All right. So give me a minute. All right. So can you see my screen now?
Yes. It says, all right. Up there. Clear.
Yes. So let's talk about diabetes in the eye. Okay. So first let's understand India today is one of the largest diabetic populations in the world. And I'm talking about 2015 statistics. We have, in 2015 statistics show that we had 62 million diabetics compared to 18 million in the USA. Now that alone should open your eyes, okay?
Absolutely.
25% of the world diabetic population as of today reside in India. And approximately 1 million Indians die every year because of diabetic complications.
Okay.
So what about the impact of diabetes on the eye? About a quarter of all diabetic patients, 25% of diabetic patients are going to have diabetic related eye blindness. 130 million people are diabetically blind in 2020. And I'm not just talking about the impact on the individual quality of one's lifestyle, the socio-economic impact of diabetic eye disease. Mind you, I'm not talking diabetes now. I'm talking diabetic eye disease is in the billions of dollars, Okay. So let's try and understand what happens to the eye in diabetes. So what you're looking at right here is the normal retina. Remember, I spoke a while ago about the retina.
That's right.
So this is what the retina looks like. When I examine your eye, when I put a lens to your eye, this is what I'm looking at. So the bright button right in the center, towards the not in the center, towards the side, is the optic nerve. Okay. And that brighter reddish spot right in the center is the macula. So did you get me?
Okay. Absolutely.
And these red crisscrossing lines are the blood vessels inside the retina. Okay. Now, what happens in diabetes is these blood vessels. So for a normal, let me take a step back. For these blood vessels to function, okay, they have to be watertight. That means the fluid, the blood flowing through these vessels have to remain within these vessels. They bring blood and important oxygen and nutrition to the retina and keep the retina functional. So think of this as a concealed water pipe in your bathroom. As long as the water is flowing through the pipe, everything is great. You enjoy a fantastic shower. Now, what happens if slowly tiny little cracks develop inside those water pipes? So what happens in diabetes in the beginning is tiny little cracks start developing in these blood vessels. You start getting micro leakages. So it's not blood, it's just a little bit of fluid from the blood vessels starts oozing out into the surrounding retina. And that begins a cascade of irreversible changes. So you start getting the surrounding retina, fluid starts collecting in the surrounding retina, the retina starts getting swollen. All right. Now, as time passes by, this is what I was talking about. I think slides will have more visual impact than just speaking about this.
Absolutely.
This is early changes. So can you see those yellow spots and those red spots? Looks very different from this picture, right? This is a normal retina. And look at this. So now you're seeing these tiny little yellow spots all over and these red spots. So the yellow spots are nothing but early fluid in the retina, early swelling inside the retina, and early bleeding inside the retina. So tiny blood vessels have started to escape, blood cells have started to escape these blood vessels. Now, if a patient is detected at this stage, there is a very good chance that I might be able to rein this in. There is a very good chance that we can try and arrest further progression of this disease and slow it down right here. Mind you, like glaucoma, diabetic eye disease is a progressive disease, generally untreatable, generally irreversible, unless you have detected it early enough. Now let's see what happens as you go ahead. Look at this. Does that shock you?
Absolutely.
So where's the normal retina? This looks crazy, right? There's a lot of swelling all over. There's a lot of hemorrhaging all over in the retina. So this is more advancing diabetic retinopathy. And imagine if this is advancing, what advanced is going to look like. So at this stage, your cracks have widened in the blood vessels and water, the fluid has started pouring out. Blood has started pouring out into the retina. So imagine you have your concealed pipe in the bathroom and now there are cracks and the water is coming right through and you're seeing that dampness coming into the walls.
Sure.
Now look at this. These are far more advanced stages. You've got blood that is gushing into the eye. So the cracks have, the vessels have kind of burst open. You've got, this is known as vitreous hemorrhage. So blood has started pouring into the clear jelly, into the clear fluid in front of the retina. And so typically patients at this stage come to us saying, I can't see well enough. There are these large floaters in front of my eyes. Generally at this stage, the vision is good. But from this stage onwards, the prognosis of this condition, the treatability of this condition is a lot lesser.
Okay.
Now, this is what happens as the disease starts to burn out. So finally, what happens is all this bleeding, swelling, they start scarring inside the retina. And the scar tissue, the fibrotic scar tissue starts pulling onto the retina and tearing the retina. So you get tractional detachments of the retina, you get scars inside the retina. And if you remember the picture I showed you, the normal retina, and you see this, even as a lay person, you can understand that this looks nothing like the normal retina. And
absolutely,
sometimes it can take as little as a few months to a year or two for you to go from a normal retina to a very, very damaged retina like this. And this is the end. So this is finally a scarred end-stage diabetic retina. Patients who come to us at this stage, there's precious little that can be done. Right. And the reason I've showed you the various stages of damage to the eye is I want people to understand why it is so important to have these routine eye checks and to be able to detect conditions like diabetic eye disease, conditions like glaucoma in the early stages, because at that stage, there's lots that can be done to slow down these diseases and to probably give you an optimal quality of lifestyle going ahead. But once you come to your eye doctor in these advanced stages where there is significant damage done to the optic nerve, or you have a scarred retina like this, then there is little that can be done. And diabetic eye disease is like a rolling stone down a hill. Once you push the stone over the hill, it rolls down. So there are a lot of people who come to me with advancing diabetic disease and who keep saying that, but my sugar is so well controlled, then why do I have this? The unfortunate thing is in certain people who are genetically prone to diabetic eye disease, having uncontrolled diabetes is just the kickstarter. And once the diabetic eye damage has started, even if you keep your diabetes under excellent control, there is a possibility that the diabetic eye disease could advance, and therefore you need to keep a tighter watch on the eye itself. So diabetes is one thing. You definitely need to keep your diabetes under control. You need to manage those numbers. You need to make sure that your blood sugars are optimized. But end organ damage, like diabetic eye damage, very, very important to run separate follow-ups and separate management. And I'd like to end this with one more pearl, one more take home.
Sure.
When you have diabetic eye damage, it is almost certain that similar damage is already started or is taking place in the kidneys as well. We call that diabetic nephropathy. And as I said earlier, your eyes are your window to your soul, window to your body. So the eyes have told you that, look, damage is taking place, but it's also equally important to know that there is damage taking place elsewhere, and to get yourself checked, to get your kidneys checked as well. So I just put this as a comparative. That was what the normal eye looks like. And this is what end-stage diabetes looks like. I hope I have been able to kind of share my thoughts on this disease.
Absolutely. In fact, it's so amazing, Dr. Ryan. One cannot just imagine the kind of impact the so-called diabetes could have on the eye as well. We often take this for granted. I'm so delighted that you have spent time explaining this to our viewers. Dr. Ryan, can you tell me, what are floaters? We hear this very often. We hear
Yes.
people talking about feeling some kind of floaters all around. So what exactly are floaters? And are these dangerous? And can they be treated at all? We often have this problem of seeing something, in the background out there. If you could spend some time explaining to us floaters and the impact, please.
Okay. So floaters, of course, are again another common problem that is encountered, and most people in their lifetime will see floaters. So what are floaters? Floaters are nothing but seeing something in your field of vision.
Sure.
Okay. Floaters can be of different sizes, shapes, and colors. So floaters have been described as spots, lines, squiggles, cobwebs, clumps. People say they see ants marching in front of the eyes, mosquitoes flying in front of the eyes, red, black, gray, even transparent floaters. Okay. So these are very, very common. And at some point in your life, in everybody's life, most of us will see floaters. So floaters are very, very easily seen if you look at a clear blue sky or a white wall. Stare at the white wall or a clear blue sky for a little while, and you'll start seeing your floaters. So what are these floaters? So basically at the back of the eye, okay? So let's go behind the eye again. From what I mentioned earlier, you know what the retina is, okay?
Sure.
Now the back of the eye is filled with a clear transparent gel known as the vitreous humor, okay?
Right.
Now this gel is formed once at birth and remains throughout life. It's not replaced like the fluid in the front of the eye. All right.
Sure.
Now there are cells in this suspended in this gel. Okay. Have you ever used a gel toothpaste? So if you hold a gel toothpaste to the light, you'll see these tiny little particles suspended in there, right?
That's
so
right.
In
That's
the
right.
gel of the eye, we have these cells that are suspended. Now, as we grow older, okay, pockets in this gel start getting liquefied. And these cells, they start coming together. Okay, they start forming clumps. They start moving around. And when they move around, when they aggregate and fall clumps, they throw shadows onto the retina. And these shadows are perceived as floaters. Okay, you see something moving in front of your eye. This is nothing but some kind of cell that is either moving inside the eye or clumping together inside the eye.
Sure.
Now, there are different types of floaters, different types. Most of the floaters are age-related. Okay, these are degenerative floaters. Floaters are commonly seen as a result of advancing age. You can see floaters after injuries, eye infections, eye inflammations, eye surgeries. And most of the time, floaters are absolutely harmless except for the tremendous nuisance value that they've got.
Right.
I mean, believe me, I've had to refer patients to psychiatrists because of floaters. They are so disturbed. They're so disturbing at times. Okay. Unfortunately, most of these age-related degenerative floaters have no treatment.
Okay.
And I remember a very, very wise professor once telling me, the only treatment for floaters is reassurance.
Okay.
You need to reassure the patient that there's nothing wrong with your eye. You aren't going blind. You're not going to lose your eyes. Okay. But there's going to be a nuisance for some time. Okay. Nobody likes to see mosquitoes in front of their eyes all the time, right?
Sure.
But the good thing about floaters is they eventually go away.
Okay.
Sometimes they go away in days, in weeks. Sometimes they take months. And unfortunately, sometimes they take several months to years to go away. But most floaters eventually go away. And when I say go away, I don't mean they go away as in disappear. They're cells in your eye. They're not going to go anywhere. But they kind of float out of your vision, from your central vision into your peripheral vision. So after a point of time, you stop noticing them. You stop bothering about them. But I always tell people they're not really gone. If you search for them, if you look for them, they're going to come back again. And that's why they're called floaters. They actually float in and out of your vision. But eventually, over a period of time, they kind of move into the periphery of your vision. Yeah, sorry.
Yep. So what exactly do you mean when you say, doctor, that if you look for them, can you explain that a little bit more, please?
So like I said, over time, a lot of people stop seeing these floaters. They move into the periphery of your vision. But sometimes, they come back into the center of your vision. So if you're looking at a clear blue sky or a white wall, or let's say they just move back, they float back into your vision. So you see them again. But Sanju, there's one more point I want to drive home. Most floaters are degenerative. They're benign. They will not cause any problem to the eye. Okay. But there are floaters that can be very, very dangerous. Okay. So a very small percent of patients may have floaters that are associated with tears in the retina. Okay. So you can have certain conditions that tear the retina, that cause a burst of cells into the retina that people perceive as floaters. So typically these are floaters that appear all of a sudden. They appear like a cloudburst. And very often they may be preceded by or followed by flashes of light, like camera bulbs popping off from the side of your vision. So if these are not detected correctly, they can have profound and serious long-term implications on vision, because if tears in the retina are left undetected, they could predispose to a blinding condition, which is retinal detachment in the future. Not all tears may necessarily cause detachment, but then you're at a very, very high risk. So therefore, any patient with floaters must have their retina examined for the presence of tears. If tears are detected, they are treated accordingly. But if there are no tears or associated pathologies in the retina, then reassurance, and reassurance remains the modality of treatment for floaters.
Okay. Doctor, let me try and get on to another topic that probably would interest a lot of people, cataract. What exactly is cataract? And, we know of many stories nowadays where you have patients talking about doing a cataract surgery and being back to normal almost immediately or almost instantly. Now, how exactly is cataract surgery done in 2021 different from probably a cataract surgery that was done in probably the 80s or the 90s? Is it vastly different? Spend some time talking to us about cataract, doctor.
Of course. So Sanju, cataract, of course, is one of the most common eye problems that people are aware of. Right. I mean, glaucoma, macular degeneration, people have heard about them, but almost everybody has heard about cataract. So let's start with the basics. What is a cataract? A lot of people are still under the misconception that the cataract is a membrane in the eye, it's a growth in the eye, and various other things. So very simply put, the cataract is nothing but a part of your eye. Okay, the lens, the human lens in the eye, a structure made up of protein and water that is clear throughout your life, starts to gray with age. It starts to get opaque with age. Okay, so it's like the graying of hair. When you start graying and you look at yourself in the mirror, You don't say I'm sick, you say I'm getting older. So likewise, the clear lens in the eye starts to gray with age. And as it grays, the amount of light that can transmit through this lens starts to reduce. This graying, progressively graying lens in the human eye is the cataract. Theoretically, a cataract can start as early as your 40s, because once you reach a certain age, say your late 30s, early 40s, mid 40s, the lens is no longer a clear lens. There is a subtle discoloration to the lens, and theoretically, that's when cataract has started in the eye. But of course, at that point of time, it does not impact vision. As the cataract, as the opacification, as the graying of the lens progresses with time, the amount of light that can pass through the lens starts to reduce. And this is the development of the cataract. Now, you mentioned something about surgery. Surgery done in the 80s and the 90s and surgery done today, there is a sea change. I cannot even begin to talk about the differences.
Okay.
In the 80s and the 90s, cataract surgery was largely a manual technique where you had to actually cut open the eye with a large incision, manually pop the cataract out of the eye, which was then shown to you. Look, this is your cataract. It looked like a little button. All right.
Right.
And then, because you had to actually cut open the eye with the blade, you stitched the eye back up again. Now, you understand this obviously would take a long time to heal. Okay. So in the olden days, cataract surgery took weeks and weeks to heal. And there were tremendous restrictions that were placed on the patient. Don't go out, don't go near the fire, don't do this, don't do that. So even today, the impact of cataract surgery done in those days is felt. People still dread the word cataract surgery because of the impact it has had in the past. But I can assure you, cataract surgery in 2021 is a completely different beast altogether. So what we do today is in barely a 10 to 20 minute procedure. We remove the cataract through a keyhole incision in the eye. We take a micro incision in the eye, okay, which is probably between 2 and 2.5 millimeters, okay, and using a certain form of ultrasound energy, we soften, we liquefy the cataract in the eye. See, at the end, the lens is just protein and water. So once you deliver ultrasound energy to the lens, we are able to liquefy and suck the liquid lens out of the eye. So we no longer need to actually cut open the eye and pop the cataract out, and therefore we can no longer show the cataract to the patient. I still get people today who come out after surgery and say, "Doctor, can I see my lens?" Well, that's not possible anymore.
I can imagine. Absolutely.
Yes. And technology has advanced to the point now where we can implant a lens back into the eye through that tiny little keyhole incision. Not only that, so what is the lens? The lens is basically the structure that has contributed to the power of the eye, right? A lot of patients ask us this question, can we do the surgery but not have the lens implant? Well, if you don't have the lens implant, you've removed the lens, the power from the eye. Where are you going to get that power from? So like in the olden days when there were no lenses, you would end up having to wear these extremely thick, what was called the Coke bottle or the soda bottle glasses. Right. The technology has changed. Somewhere in the 90s, we started implanting lenses in the eye that would kind of compensate for the lens power of the cataract removed. But today, the technology is so advanced that we can accurately compute this lens power so as to completely reduce or eliminate your dependence on external glasses after the surgery. And today, technology has reached a point where you have you have literally a buffet of options. You have multifocal lenses, you have trifocal lenses, you've got the newest technology, the newest generation of technology known as EDOF lenses. And these are lenses which actually enable you to see, to read, to watch TV, and to do almost everything without dependence on glasses. So cataract surgery today in 2021 is not just about taking out the cataract from the eye. It's also about giving optimized quality of vision back to the patient with minimal dependence on glasses or no dependence on glasses, and thereby improving the lifestyle of the patient. So there has been a sea change in the way we look at cataract today and the way we take care of a cataract today.
amazing how technology has moved on, Doctor, making it so much easier for us. We are aware that we live today in a digital world. Increasingly, we are exposed to screens all the time. In fact, you see kids today, even if they want to place an order with their bajiwala, they would probably run across to their cell phone and do that. It's a digital world today. Now, can you spend some time, particularly against the background that we are so much in a digital world today, some kind of time in explaining to us the effects of increased screen time on the eye? All right. And are there any simple suggestions that you could provide to us for screen safety?
Right. So I'm going to start off directly with the presentation out here once again.
Sure.
So can you see my screen?
Yes, absolutely clear.
So digital eye strain has become the buzzword of 2020 and 2021. What with the pandemic and lockdowns and all of that, most of us have been confined to our homes, whether you're a student, whether you're a child, whether you're a young adult, whether you're a working professional, or whether you're a senior citizen. Most of us have been confined to our homes, have been confined to our screens, right? Now,
right.
When we were growing up, the only concern our parents had was this child is watching too much television.
Right.
As an eye doctor, I was only concerned that my patient was seeing too much of TV. But today, screens are just about everywhere. They're all sizes and all shapes. So you have television screens, you have screens on your mobile phones, on your tablets, on your laptops, on your computers. You have screens everywhere, and there's no escaping screens today. So now with increased screen time and increased exposure to screens, we need to understand that this whole new concept of digital eye strain is gaining traction, is gaining significance. So what is digital eye strain? So digital eye strain refers to a group of eye and vision related symptoms that are associated with increased screen time. Almost impossible, difficult to avoid in a modern lifestyle. So what are the symptoms of digital eye strain? The most common symptoms are tiredness of the eyes. People typically say the eyes feel tired all the time, fatigue, headaches, irritating headaches, dry eyes. It's something we can talk about a little later again. Blurry vision, defocus, not so much as difficulty in seeing, but defocus of vision. Then you have actual symptoms. You could have a red, itchy, irritable, watery, sore eye. So these are some of the more common localized eye symptoms. But you will be surprised to know, Sanju, that there are a lot of other symptoms that are not related to the eyes. And these could include a feeling of general fatigue, a feeling of listlessness and feeling tired all the time, a feeling of being disoriented or being giddy. And you will be surprised to know loss of appetite and even loss of libido has been reported as a symptom of, as a manifestation of digital eye strain. So a lot of my psychiatry colleagues are reporting severe anxiety, severe depression, especially in senior citizens related to digital eye strain. So what are the causes? What causes this? So the first thing is when you're staring at screens all the time, and most of us, I don't think any of us can escape this, you're blinking a lot less. So we normally blink about 10 to 15 times a minute. And it is found out that when you're using screens, you probably blink as little as 5 to 6 times a minute. So less blinking results in your tear film drying faster. So you end up with these dry, irritable eyes. Then again, prolonged exposure to the light radiation from these screens. I mean, we need to understand that screens are throwing light into our eyes. Our eyes, through history, have never been evolved to be exposed to this kind of light. So light radiation itself, issues with glare, reflections, poor lighting, wrong angles, wrong postures. I mean, basically your workstation ergonomics. Coming locally to the eye, very often people who have numbers but don't wear their glasses, so uncorrected numbers, certain other medical conditions like imbalances of the muscles of the eye. I mean, that's going into a whole different topic altogether. And very often a combination of these factors end up in the eyes feeling tired, in the eyes feeling listless as a result of prolonged exposure to screen devices. Now, what are the ways to avoid digital eye strain? I think this is an important take-home message. Everybody, or most people would have heard about this 20-20-20 rule. Okay,
that's right.
Let me say that. So what is the 20-20-20 rule? it is said that for every 20 minutes of screen time, take a 20-second break and look at something 20 feet away. Okay, but this is just a guideline at best. I think you need to individualize this. You listen to your own eyes. Your eyes are going to tell you when they're tired. And when they're tired, when they're watery, don't keep staring at the screen. So 20, 20, 20 can be 15, 15, 20 or 15, 30, 15 or whatever. But you need to understand that every now and then you need to gaze away from your screen for a short period of time. I'm not saying take a coffee break. I'm not saying you need to go and take a coffee break. You just need to look away from your screen into the distance. Maybe look outside your window and look at the furthest thing you can see outside your window. Okay, and rest your eyes. Another very important thing is what I call workstation ergonomics. Make sure that your workspace where your screens are well adjusted, adequate lighting. Make sure there's no glare from the screen. Use anti-glare screens. Okay, blue light. A lot has been spoken about blue light. I think it's overrated, but yes, there is some importance to reducing the amount of blue light. The correct viewing distance, which should ideally be 20 to 25 inches from the eye if you're using a laptop or a desktop screen. And this is the most important thing, the viewing angle. This is a very, very simple take-home message for everybody. The upper edge of your screen, whether it be a 27-inch iMac or a 15-inch laptop, or the upper edge of your screen should always be slightly below your eye level. Never ever use a screen with the upper edge above your eye level. That can significantly increase eye strain. Okay. Well, we're talking about the eyes, but your seating posture is equally important. It's equally important to be comfortable when you're seating. Your elbows, your wrists have to be very comfortable. Your feet should be on the floor. So this is all very, very important. Of course, if you have a number, you should correct your refractive error. Always use screens using the correct glasses. And try to blink more while using your screens. Try to blink more, lubricate the eye regularly. Most people are prescribed lubricants nowadays for digital eye strain. So just a take-home message here, Sanju. A lot of parents have come to me during the pandemic expecting magic answers. They want like a mathematical equation. And they ask me, how much time can my child spend in front of the iPad? How much time can my son watch the computer? How much time can my daughter view Netflix? There are no rules. Believe me, if you're looking at any doctor giving you a rule, there are no rules out here. It's all about self-regulation. Listen to your eyes. Your eyes will tell you when they're tired, and then you know it's a good time to stop. The 20-20-20 guideline is great, but you need to listen to your own eyes. So I tell this to parents. I mean, you can't avoid today, let's say, spending 4 hours in front of your screen because your child has to attend online classes or has to do an online project. So you can't avoid that. But if you're doing 4 to 5 hours of screen time because of your school project or because of your work, okay, you worked on an Excel sheet and you've had a deadline to submit it. Fine, that's great. That's fantastic. But then after that, the moment you're done with that, don't pick up your phone and start looking at Facebook or looking at your Instagram profile. Don't switch on the TV and start watching the next hot series on Netflix. Take a break. So this is what I mean when I say self-regulation.
Sure. Dr. Ryan, we often hear of dry eyes today. This is very common terminology that we hear. Even people who have excessive watering as a symptom are often told that they have dry eyes. Now, this sounds like a bit of an irony, but can you shed some light on dry eyes and its treatment? Is there some treatment for dry eyes?
Okay. So again, this is a slight continuation from the last question. And yes, dry eyes are increasingly common today, and digital eye strain is one of the causes of dry eye. So what is dry eye? As a layperson, dry eye basically means my eye is feeling dry. Okay, so let's understand. We have glands in your close to your eye that produce your tears, right? And the tears move into the eyes. Now, the tears do not have only an emotional function. Yes, of course, if you're sad or you're happy, you might cry. But there is a very important function of this tear, and that is to wet your eye. Do a simple exercise. Just stop blinking for a little while. In about 10 to 20 seconds, you're going to know something is wrong. Okay. And whether you like it or not, after a given period of time, maybe 20 seconds, maybe 40 seconds, maybe a minute, you're going to want to blink your eye. And that's because the wetting effect of your tear film has gone. So when you blink your eye, you're basically what you're doing is pushing out the old tear and bringing in new tear into your eye. And that tear is wetting the surface of the eye and keeping it comfortable. So anything that disturbs this equilibrium and does not allow the tear film to adequately function in wetting the surface of the eye can result in dry eyes. Okay. Now, dry eye has various symptoms. There are different symptoms of dry eye. It could be something as mild as saying, I feel dry. My eyes don't water enough. Or it can be something as complex as an inflammatory dry eye, where you have red, swollen eyes, which you can barely keep open, right? Now, again, you mentioned something about watering of the eyes. Now, that is paradoxical, actually, because there are cases of dry eye where actually the patient comes in with excessive watering of the eyes. And I'll explain that in a moment. So when you're talking about dry eyes, there are two forms of dry eye. There is a quantitative form and a qualitative form. Now, in the quantitative form, there is actually less tear being produced. Simple. There's less tear for whatever reason. There may be an inflammation of the tear producing glands. There may be some injury in the glands. There may be something that's actually causing less tear to be produced. And because there's less tear, I feel the eye is dry. I feel the need to blink more often. I feel irritable in the eye. But there is something else known as qualitative dry eye. And qualitative dry eye is basically where the glands are producing enough of tear, but the quality of that tear is not good enough to wet the eye and make you feel comfortable. And there are various conditions. So I'll just digress for a moment here. If you understand that tear film is quite complex, it's not just water that's in your eye. But think of the tear film as a triple layered sandwich, a triple decker sandwich, okay, where the middle layer is that water. But in front of the middle layer, you've got a lipid, a fatty component, which is produced by oil glands inside your lid. So the oil glands produce this oil that kind of coat the front of the liquid, the tear film, and help to stabilize it so that it doesn't evaporate too fast.
Sure. Okay.
So it kind of stabilizes your tear film. And behind the water, there's mucus that kind of helps to stick the tear film together. So all these work together in synergy to help us maintain a normal tear film. So anything that disturbs either of this, eyelid disease, gland disease, eye disease, can affect the way the tear film functions. So that's dry eye for you. And there are various factors that can cause dry eye. The most common being lifestyle, environment, digital eye strain, increasing screen time, spending more time in air-conditioned environments, certain eye diseases, certain systemic diseases. So we have inflammatory dry eyes caused by severe rheumatoid arthritis. We have an autoimmune inflammatory condition known as Sjogren's syndrome, which can also cause this. So, and last but not the least, there are certain medications, the common cold popping medications, like your antihistamines, which if taken in excess can actually cause dry eyes. So treatment of dry eyes is again a whole complex thing altogether. Lifestyle adjustment, lubricating eye drops, but that's a very different topic altogether.
All right, Dr. Ryan, I'm going to pose one last question before we take questions coming from the audience.
All right.
Can you provide us some kind of basic tips, general basic tips on taking care of our eyes on a daily basis? You know, something which is like a ready reckoner for people to go to just to take care of their eyes.
So Sanju, I have a small slide prepared for that. But before I put on that slide, I want to emphasize here, there are no written rules. It's just common sense. It is just simple common sense. And you'll understand that when I put up the next slide. Sure. What's very important is to educate oneself. So talks like these, help people understand more about health. So educate yourself, read. Today, the internet there's ample information available out there. Talk series like this actually help you to educate yourself and understand things more. If you educate yourself and you're aware, if you bust the myths and understand the facts, then you're going to be more careful of your eye health and health in general. So with that, I'm going to share this slide with you.
Sure.
And I've enumerated a few points and we'll go through them slowly.
Sure.
So just let me know if this last slide is up on.
Right.
Okay. So
You're
as I
talking
said,
about the
more
basic tips? Yes, that's the
so
slide. Yep.
these are the basic tips that you asked me for. So
Sure.
there are no written rules. It's just common sense. Okay.
Right.
So the first and most important thing, not just for eye health, but for general health, is a healthy lifestyle. So healthy nutrition, adequate sleep, of course, avoiding smoking and things like that. So a healthy lifestyle is very, very important. That's why you have these lifestyle gurus today who coach you. You actually have lifestyle coaches who teach you on how to live a healthy lifestyle today. Sleep is a very, 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 very important factor. Today, most people are awake into the wee hours of the morning, watching movies on Netflix, using their phones in dark rooms. So this is very important, okay? The second thing is, of course, adequate care while working with screens. I think we spoke enough about that a little while ago on how to take care of workstation ergonomics and how to and general care while working with screens. Screens are everywhere today. Like I said, whether you're a student, whether you're a working professional, whether you're a retired person, whether you're a senior citizen, screens are just about everywhere. Hell, even little children are distracted by putting an iPad in front of them. I've seen a 6-month-old at a restaurant sitting, staring into an iPad screen. So screens are everywhere. You can't escape them. So make sure you at least take the right care while working with screens. Well, again, avoid rubbing or touching your eyes unnecessarily. A lot of people have this habit where they rub their eyes like they're kneading dough. Be very careful. Your eye at the end of the day is a very delicate, very sensitive, and very, very complex organ, which is responsible for one of your most valuable senses, and that's eyesight. I don't think there's anybody in the world who can say that they're ready to risk their eyesight. So avoid rubbing, avoid touching your eyes. Another important thing for sports people, if you're playing any kind of contact sports or racket sports, please, I cannot say this enough. Wear protective eyeglasses. In 20 years, I've seen so much of avoidable sports injuries. Please wear protective eyeglasses while playing tennis, badminton, any kind of contact sports or racket sports. Protect your eye from UV exposure and direct sunlight. I think that's common sense. Okay. We spoke about this earlier. Diabetics, please have your eyes examined routinely for damage to the retina. Please be aware that diabetes is not just about your blood sugar and about numbers. It's also about the end organ damage to the eyes, damage to the kidneys, damage to your nerves. So please have your eyes examined routinely. Have regular eye examinations by a qualified eye care provider. So make it a point. So a lot of people say, but why should we have an eye examination if I'm feeling perfectly fine? I can see perfectly well, I can read, but why should I have an eye exam? Well, I hope that what we have spoken in the last 40 minutes or so has answered that question. It's important to have these exams so that certain conditions which have no early warning symptoms or signs and that can cause serious and profound impact to your vision in the future can be picked up or detected or diagnosed early and treated early. And then, of course, there are special precautions for a special group of people. For example, contact lens wearers need to understand that contact lenses are not toys, and you need to take special care and when you're dealing with contact lenses. So these are a few points that I could enumerate when thinking about simple daily basic tips for eye care on a day-to-day basis.
Dr. Ryan, I must admit, that was an incredibly useful session, studded with facts and solutions to protect our eyes right through. I've no doubt whatsoever, Doctor, that many would sit back home today, richly reminiscing on the many thought-provoking, in fact, tips that you have provided to our listeners. Thank you so very much. Before we move on to questions from our audience, I have an important announcement, Doctor. So we'll just take a break of a minute for some announcements and then come back to questions from our audience. I'd like to remind our audience, if some of you want to pose any questions across to Doctor, please go ahead and do it right away. We already have 7 questions. We do not have time for too many, but those of you who are still interested, go ahead and do it right away. Here is an important announcement now, ladies and gentlemen. Our next talk show under the Knowledge Worth Having series will be held in January 2022. If all goes well, the next talk show could be held in person at the Grand Hall at the Catholic Gymkhana, Marine Drive, Mumbai. Details will be circulated in due course. Effectively, this will be our last virtual show, at least for 2021. And now, here is an extremely important announcement. On Saturday, the 11th of December 2021, at 8 p.m. sharp, we have the Catholic Gymkhana Carol Night Show. This show is not a physical show, but a virtual show like last year. Some of you may remember that last year, the Catholic Gymkhana Carol Night Show attracted a huge viewership of more than 2,300 simultaneous logins during the show. I'm sure that must have been some kind of a record. This year, we expect to have an equally successful and equally interesting performance with artists from across the globe. This is a program that you just cannot miss for anything in the world. So be there on Saturday, the 11th of December 2021 at 8 p.m. sharp. The host for the program will be the charming, stunning Sylvina, who will also personally chip in with Christmas mashups that she's so famous for. So be there, ladies and gentlemen. Don't forget, Saturday, the 11th of December 2021, it's going to be a virtual show only on the Catholic Gymkhana YouTube channel, the very same channel on which this talk show is being viewed this morning. Ladies and gentlemen, we will now move on to questions from our audience, Doctor. And I seem to have about 7 questions already. I can still see there are some more coming in yet. And I'll request our control room, Aubrey, to stop taking any further questions, please. All right, I think we'll be flooded out here with questions already. I can see some more streaming in already. Okay, let's get on with this. 8 questions already, Dr. Ryan. Let's move on to this right away. Our very first question. At night, sometimes I get eye burning and dryness, as well as when I blink and apply my saliva, I feel better. What eye drops should I use?
Okay, the first thing is, please do not apply anything unprescribed into the eye. I've heard people applying saliva, different types of oils, and you could end up with chemical conjunctivitis. So I implore you, whoever has asked the question, do not apply anything unprescribed into the eye. The eye is very sensitive and very delicate. Use only prescribed medications. So what you have asked sounds to me like some form of a dry eye, which of course would need further evaluation if the symptoms don't improve. However, for now, any good topical unpreserved lubricant eye drop, and there are a dime a dozen, should work very, very well. So you could ask your eye care provider to prescribe you any topical unpreserved lubricant eye drop. You can use this as little as 2 or 3 times a day, or as often as every couple of hours, and you should have adequate relief from your symptoms.
Okay, question number 2. I think this was addressed by you, Doctor, but nevertheless, and somebody has asked the question, and this was asked very early into the show, so I'll go through the process of still putting this across to you.
Sure.
What are eye floaters? You've covered that. And what are its causes and repercussions? You've covered that, but just in a few lines.
Yes, so we've covered that adequately. Just to recapitulate, eye floaters are nothing but cells inside the fluid of your eyeball that are casting shadows onto the retina. So in most cases, eye floaters are age-related or benign. They don't cause any serious issues to the eye other than the nuisance value, and they almost always settle down with time, which could range from days and weeks to months to years without any treatment whatsoever. However, it's equally important to be aware that there are rarely, on rare occasion, there are certain types of eye floaters that could be associated with pathologies in the eye like tears in the retina. And therefore, it is very important for anybody experiencing floaters to have their eyes examined by an ophthalmologist to rule out the incidence of these kind of retinal pathologies.
All right, question number 3, Doctor. Can you share some light on kids with myopia and how to control it?
Okay, so basic kids with myopia. So myopia is primarily a refractive error. Okay, it's nearsightedness, where typically the person affected, the child affected or the adult affected can see things close by, but have difficulty in seeing things far away. So myopia is otherwise known as nearsightedness, and it's rather common in children that are growing up. Okay, so it is believed that 95% of myopia is strongly because of genetics. So there is a genetic influence, and unfortunately, there's not much we can do to control the genetic aspect of myopia. So if one or more parent has had myopia as a child, it is likely that 50% of the offspring will have myopia. Okay, 5% is attributable to environmental factors like the excessive use of reading, the excessive use of screens, the excessive use of near work. But ideally speaking, once myopia is detected, then suitable corrective glasses have to be worn or should be worn. So as I said earlier, right at the beginning of my talk, it is important to have children assessed every 3 to 5 years of life, so that if a child is diagnosed with myopia, then suitable correction can be provided to the child so that the child does not have to suffer with suppressed vision or amblyopia or lazy eyes in later life, right? But just to end that, there is no real way to prevent myopia. Myopia is something that happens because of genetic influences, and the best way is to have it detected and wear the appropriate correction so that the child's vision develops correctly at the right time. When the time is right, there is enough technology to remove the number.
Well, Doctor, we have 9 questions here. I can still see some more coming. May I request our control room to stop taking any further questions, please? We don't want to be ending at the show at dinner time, all right? So we'll just stop with further questions. We move on now to question number 4, Doctor. They say that eyes are windows to the human body. Doctor?
Yes. Yes.
If airiness or aneurysm are seen on the retina of the eye, can we conclude that there could be many in the blood vessels of our body?
So can I hear that again? If what did you say? What is seen in the blood vessels of the eye?
They say that eyes are windows to the human body.
Yes.
If aneurysm, AENEWRISM, all right.
Aneurysms, yes.
Okay.
Okay. So yes. So as I said time and again during the talk show, the eyes are indeed the window to your body. So an interesting fact here: the eye is the only place in the human body where you can actually see blood vessels live. Any other blood vessels in the body can only be seen after death on an autopsy. The only place in the human body where blood vessels can be seen in a person who's alive is the retina of the human eye. And the blood vessels tell us a lot of stories. So conditions that affect the blood vessels, like most commonly diabetes and blood pressure, show up in the eyes, and therefore it gives us an indication that something's not wrong, something's not right in the rest of the body as well. So for those who don't know what an aneurysm is basically an abnormal dilation, an abnormal bulging at the end of a blood vessel. So any kind of abnormal bulging or dilation at the end of a blood vessel implies an aneurysm. Seeing aneurysms in the eye doesn't necessarily mean that you have aneurysms in the rest of the body, but it definitely does imply that some kind of pathology is happening in the body. The most common aneurysms in the eye are seen in diabetics, in the earliest stage of diabetes. So one of the first changes in the human retina in diabetics are what we call microaneurysms. These are tiny little red dots, bulges at the end of the retinal blood vessels. So the moment we see these aneurysms, even if the patient is not diabetic, we ask them to have their blood sugars checked, and very often we find that the patient could be diabetic. And aneurysms, of course, are also seen in a host of other diseases. And presence of aneurysms in the retina implies that further investigation is necessary.
Okay, we move on to question number 5. We already have 12 questions. May I request our control room to stop taking any further questions, please? We're moving on to question number 5. My sister is supposed to have glaucoma, and in spite of putting Dorzox, D-O-R-Z-O-X, I'm presuming
Yes.
that's some kind of a medication, Combigam twice a day, and Travitin at night, there still seems to be no improvement. Can you suggest anything?
Okay, so this is a complex question, Sanju, but I'll try to answer this to the best of my abilities. So, like I said during the talk, that glaucoma is a progressive disease. It's like the boulder that's been tipped off the hill. So once it starts, there is a cascade. So most glaucomas, fortunately today with the advance in medication, most glaucomas can be medically controlled. When we were students, we just had 1 or 2 drops that could be used for glaucoma, and most glaucoma subjects ended up having to have surgery. Today, fortunately, almost all glaucomas can be controlled very well with glaucoma, and very few patients actually end up going to surgery. Having said that, there's something known as maximal medical therapy. So once you are on the maximum number of medical drops, eye drops that a patient can be put, and yet there is documentation of progression of the glaucoma, then obviously for that particular eye, medical therapy is not working enough. And you may have to move to the next level, which is either lasers or surgery or implants. All right. Again, as I said, unfortunately, glaucoma is an apoptosis. Apoptosis means a programmed cell death. So there are certain cases which will continue to progress and deteriorate despite every possible kind of information. It is unfortunate, but that is the case. Now, when you said your sister has what, I need to know what exactly is her problem. Is it her vision? Is the glaucoma progressing? Is there documentation that the glaucoma is progressing? But either which way, regular follow-ups and monitoring is extremely important. I have a general rule of thumb in glaucoma. Whatever vision is lost in glaucoma is lost forever. What we do as doctors and your responsibility as patients is to try and preserve the existing vision, because what's gone is gone. So whatever vision your sister may have unfortunately lost because of glaucoma, it may be difficult to get that back again. But you have to work with your doctor in making sure that she doesn't lose any further vision, whether that be modifying her medications or looking at other alternatives like lasers or surgery.
All right, question number 6, doctor. Can eye exercises or any other food help in correcting vision in kids? And can exercises in general help improve our vision?
Okay, so that's a good question. So the first thing is, if you're talking about vision, so vision is a complex thing. If the cause of weak vision is a refractive error, that means glasses. Okay, and in children, the most common cause of poor vision is a refractive error. Then the only thing that can improve is wearing your glasses and routinely checking the eye, so that if the number changes, you need to update your glasses every now and then. Okay. Good nutrition is, of course, very, very important, not from the point of view of just correcting vision there's no magic formula here. Nutrition is important for overall general good eye health and general health, overall well-being. Having said that, now eye exercises, that's a whole different ballgame together. Eye exercises cannot and has not been scientifically documented to slow down the progression of myopia or stop alter any kind of change in the number. Eye exercises, you remember I said there are other kind of eye professionals like orthoptists and vision therapists. So
that's
there
right.
are specialized eye therapists, vision therapists that do specialized scientific eye exercises, but these are for very different eye conditions altogether. So there are children and adults who have problems with the muscles of the eye. So something known as muscle coordination. So, when the eyes move, they move in synchrony. They move to the left or to the right, or when you're looking inward, they move inward together. Anything that affects the muscle coordination of the eye results in something we describe as binocular anomalies. And there is evidence here that certain specialized forms of eye exercise known as orthoptics or vision therapy can help binocular anomalies. But if you're looking for an answer, will my child's vision improve, or will my child's number stop increasing if I do eye exercises? The answer is an emphatic no.
Okay, we will stop at question number 14. We are not going to be entertaining any further questions right now. We are now on question number 7, Doctor. Still 7, 8 to go. My eyes are highly sensitive to bright lights and find driving at night very difficult. What can I do to control this?
Okay, so again, to answer this question correctly, I would need to know your age group. So if you are in the age group where the possibility of cataracts are there, then you need to have your eye examined. The most common cause of increased glare or difficulty in night driving is the early onset of cataract. So if you are in the age group of 45, 50 and above, you need to have your eyes examined for the onset of cataract. However, having said that, as we grow older, a certain amount of glare, light sensitivity, and difficulty in night driving is quite common. And you need to probably use some form of anti-glare glasses to have this corrected.
Okay, question number 8, Doctor. It says Flogel eye drops, F-L-O-G-E-L. I'm presuming that's Flogel eye drops.
Yes.
For dry eyes must be used for life, as one eye doctor said. The other said that it should be reduced over time. What should I do?
So I don't think anyone is right or wrong out here. Flogel is one of the topical unpreserved lubricants that I mentioned earlier as a treatment for dry eye. It is one of the many eye drops that are available. This particular eye drop is from Cipla, and it is it's a very good eye drop. Having said that, there are no rules out here, Sanju. There are people with moderate to severe forms of dry eye that might need to use lubricants like Flogel for the rest of their lives. There are some people, some fortunate people, where dry eye management brings their symptoms under control. And then you may need to use Flogel only for a specific period of time. So I think it's very important to individualize out here and take things as time goes by. I have a lot of patients whose dry eye symptoms improve over a period of several months to years, and then we actually taper down their dry eye management. But there are people with severe forms of dry eye, with inflammatory dry eyes, who may have to actually continue lubricants for the rest of their lives. And sometimes there is a small subset of people where even lubricants do not help, and they may have to explore further options like topical anti-inflammatories like cyclosporin, or even certain newer forms of light therapy like intense pulse light therapy, LipiFlow, meibomian gland procedures, and so many others. The dry eye management has come a long, long way, and topical lubricants like Flogel is only the beginning of the journey. Okay.
Question number 9. Can rectus palsy be reversed, and what are the treatment options?
So again, a complex question, because knowing you need to understand what is the cause of rectus palsy. So I'm presuming you're talking about lateral rectus palsy, which is basically a problem. So here what happens is the binocular function of the eye is affected. So this is typically a neurological issue. There is, more often than not, it is the nerve that controls the movement of the eye that's affected. Okay, the 6th nerve, to be very specific, is affected. So the 6th nerve is the nerve that moves the eye outward. All right, do you get that? It moves the eye outward. So anything that affects the 6th nerve, that's the lateral rectus, okay, will prevent the eye from moving outward. So depending on what has caused the lateral rectus palsy, treatment accordingly has to be initiated, and prognosis can accordingly be determined. Having said that, the most common cause of lateral rectus palsies are viral infections. So most of these cases improve on their own with just good nutrition and vitamin supplementation within approximately anywhere between 6 weeks to 6 months. And the only thing is, during the time when you are waiting for improvement to happen, the most common problem is double vision. So the double vision has to be managed by your doctor to make sure that you're comfortable during the time where it improves.
What causes twitching of the eyes? Next question, doctor.
I get this asked almost every single day.
I can imagine, yeah.
First and foremost, the eyes never twitch. Your eye cannot twitch. It is the lid. It is the lid that twitches. Okay. So the lid has very delicate muscles, and anything that causes the nerves to misfire and causes the muscles to flutter on their own is basically twitching of the eyelid. So the right question would be what causes the eyelids to flutter and not the eyelids. So just like you get fasciculations anywhere in the body, very often in the muscles of the, the arm, sometimes in the jaw, you get these tiny muscle fibers that just go on fluttering. It's nothing but an irritable nerve. The causes are a dime a dozen. Honestly, nobody knows the real cause, but there are various possible causes. Typically, poor lifestyle. So, irregular sleeping hours is one of the most common causes. Bad nutrition, smoking. Smoking is again a very, very, very important cause. So a lot of poor lifestyle choices can contribute to these fasciculations, these twitchings. We medically call these eyelid myokemias. Okay. Stress, anxiety, very common causes. So, today's people, today's lifestyles, everybody's on a deadline, everybody's on a timeline. So these kind of stresses, these kind of pressures cause you stay up late into the night working on a presentation. And all of these are trigger factors for these. The best part is most of these eyelid twitches settle on their own. You don't need to do anything. Sometimes they settle within days. Some of these troublesome ones can take even up to weeks or months to settle down. What I normally do is I reassure the patient. I give them a good dose of vitamins, vitamin B12 to be specific, which is a nerve-specific vitamin, and most of these settle down on their own. There are rare cases where the lid spasms become excessive or very severe, where the entire lid goes into spasm, and that actually affects the quality of your lifestyle. So in these extremely few and rare cases, you may have to look at other options like Botox injections into the lid to relieve yourself from symptoms.
Next question, doctor. I'm not very sure I've got this right, but let's just try and answer it. Causes of EPI retinal membrane, post-EPI retinal membrane surgery vision is not full.
Yes.
Can it be increased in any way?
Okay. So again, this is a very technical question, but I'll try and explain this. So an epiretinal membrane is basically a tissue, a membrane on the surface of the retina. Okay. So any abnormal tissue or membrane on the surface of the retina, like a fine cellophane paper, is defined as an epiretinal membrane. And there can be a number of causes ranging from aging, abnormal aging processes in the eye, infections, inflammations, surgeries. There can be a number of causes for an epiretinal membrane. So the first thing is, if you have an epiretinal membrane that is not affecting your vision, or if, as a rule of thumb, if your vision is better than 6/9, then it is best to leave it alone. So keep it under observation to make sure it's not worsening or it's not progressing. But any epiretinal membrane where the vision is affected, or where there is traction on the retina, where the membrane is contracting and pulling up the retina and threatening to tear the retina, resulting in a macular hole, needs surgical intervention. So you need to get in there and peel off that membrane and remove the membrane. Now, unfortunately, most retinal surgeries, there are no real answers. So very often, even after epiretinal membrane surgery, if the underlying tissue, if the light sensing cells of the retina have already been damaged by the disease process, then visual recovery may not be satisfactory even after successful epiretinal membrane surgery.
All right. Question number 12, doctor. My right eye droops. Is there any way to treat it?
So again, to answer this question, you would need a thorough examination. Drooping of the eyelid, known as ptosis, there are many causes ranging from aging, ranging from certain systemic diseases like a thyroid dysfunction, ranging from injuries and trauma, ranging from a medical condition known as myasthenia gravis. So you need to exclude all these conditions. And yes, if there is a secondary cause like myasthenia gravis or thyroid eye disease, then by correcting the underlying cause, your eye drooping will improve. But if it's an age-related cause or simply changes in the muscles of the eye that keep the eye elevated, then you may require a form of eyelid surgery to elevate the lid again. But again, as I said, this will need specific examination.
Sure. Moving on to our second last question, Dr. Ryan. Is Systane, Systane, Systane drops the best for dry eyes?
Systane is as good as any other lubricants available. Again, it comes under a group of lubricants known as topical unpreserved lubricants, like the one mentioned earlier, Flogel. Systane is from a company, it's from Alcon. Systane has a whole boutique, has a whole portfolio of products, including Systane Ultra, Systane Free, Systane Hydration, Systane Gel. So depending on the severity of your symptoms and the type of dry eye, your doctor may choose to prescribe any of this. But yes, Systane is an excellent product from Alcon. I wouldn't say it's the best, or I wouldn't say it's one of many excellent topical unpreserved lubricants there is.
Okay, moving on to our last question, question number 14, doctor. This is going to be the last question. Okay. I'm 37 and I've just been diagnosed with high blood sugar.
Sorry, I've lost your voice, Sanju. I can't hear you. I've lost your voice.
Let me come again.
Yes.
I'm 37 and I've just been diagnosed with high blood sugar. That's 140 mg. How soon should I be checking my eyes for diabetes-related issues? Okay,
so as a rule of thumb, diabetic eye damage typically starts 5 years after the onset of diabetes. So if in the window period of the first 3 to 5 years after detection of diabetes, if you have kept your diabetes under very good control, there is a chance that you will probably less likelihood of developing diabetic eye damage. Having said that, once you are detected as having diabetes, irrespective of your age, it is prudent to have your eyes examined by an ophthalmologist once a year. If at any visit eye changes are observed, any changes related to diabetic eye damage, then your ophthalmologist may prescribe a more regular schedule of visits, which could be as little as maybe every 2 to 3 months or as often as every 6 months to a year. But if you are detected with diabetes once a year, irrespective of age, I would advise you to have your eyes checked.
Thank you, Dr. Ryan. Thank you so very much. You've very patiently gone through all of those questions from our viewers. I'm quite sure if we had allowed them to go on, this would have carried on till midnight. Only shows the kind of interest people have in eyes and how they need to protect themselves. Thank you so very much. Ladies and gentlemen, it is time now for our customary but well-deserved vote of thanks. The T20 Cricket World Cup has come and gone. India now has a new T20 cricket captain in Rohit Sharma. India also has a new cricket coach in Rahul Dravid. Many things have changed, but at CG, the one thing that has remained unchanged is a vote of thanks. Ladies and gentlemen, I'm happy to introduce to you this morning or this afternoon our very own Mr. Ian Pereira, who is a managing committee member and a part of the technical team that brings this show to you live along with Aubrey. Ian also happens to be the vice chairman of our PR committee, who along with chairperson, Ms. Yvette Malgi, brings to your home all the promotional material for our events and newsletter. A prominent photographer by profession, Ian has the distinction of presenting his vote of thanks in his own style, very spontaneous and very natural. Ladies and gentlemen, I call upon Ian Pereira to propose a vote of thanks. Ian, please.
Thank you, Sanju. I hope I can be heard clearly and seen.
Absolutely clear, Ian. Go on.
So thanks first to technology. I'm in the middle of, on the way to Kajat, and I can talk on Zoom anyway. Doctor, thank you very much, Dr. Ryan. This was an eye-opener, a really eye-opening talk. And people must have learned a lot. I mean, people tend to neglect the eyesight. It gradually deteriorates and they think, okay, it'll get better. I mean, we'll go tomorrow until it gets bad. I've been a photographer, I'm paranoid about my eyesight. And that from a young age, I've been going for regular checkups, using, not only checking eyes, it means you have to use proper lenses, good quality lenses. which is also very important. And your presentation with all the slides, with all the information was excellent, Doctor. Thank you very much. Now, Sanju, of course, gets better every Sunday, every talk, every month. And I mean, this is really the Sanju Fernandez talk show. He does it so well. And thanks, Sanju. And Aubrey, sitting in Pune, has been collating all the questions and passing them on to Sanju's wife, Nirmala, and his daughter, Crizel. And they've done a good job. Thank you very much for all that. And I think when I checked with YouTube, there were about 170 devices, not people, 170 devices logged in, so that you can take an average of 2 or 3 per device. So that's viewership, and that's thanks to our communications and PR committee headed by Yvette Malgi. Thanks to all the viewers for being here, and we hope to see you for our Christmas Carol show. And Doctor, thank you once more for this eye-opening talk. Thank you very, very much for spending the Sunday with us. Back to Sanju.
Thank you, Ian. Ian, you're so very strategically posed out there, right in the middle of a jungle, it looks like, right, with trees all around you. And this is what technology can do for you, all right? Doing a live vote of thanks right in the middle of some kind of a jungle. I'm sure it's not a jungle, Ian, but it looks like with those lovely trees all across you. Ladies and gentlemen, I'd like to remind you once again before we say goodbye, 11th of December, 8 p.m. sharp on the Catholic Gymkhana YouTube channel. The Christmas Carol night would be coming live to you. You just cannot afford to miss this program. 11th of December, Saturday at 8 p.m. sharp. On behalf of the Managing Committee of the Catholic Gymkhana, I'd like to wish all of you a very blessed Christmas 2021, a very, very, very blessed 2021, and a very happy, healthy, prosperous, COVID-free 2022. God bless you and your families. And before I end, ladies and gentlemen, here is a special thought. The face is the mirror of the mind, but the eyes, without speaking, confess the secrets of the heart. Let us all protect God's assets given to us. Take care of your eyes. With that, ladies and gentlemen, this is your friend and compere, Sanju Fernandez, signing off and hoping to see you all on the 11th of December. Thank you, goodbye, good afternoon, and stay safe.